Hi, my name is Erin Bertoli, and I am a Board Certified Behavior Analyst with Brett DiNovi Associates. The following video will address the use of match stimulation procedures and response interruption redirection to address stereotypy in individuals with autism and other developmental disabilities. These behavior analytic interventions are covered in the following areas of the BACB task list. According to the DSM, the essential diagnostic feature of autism is the presence of restricted, repetitive, and stereotyped patterns of behaviors, activities, and interests. Stereotypy and stereotypic behavior are umbrella terms that refer to this broad class of topographically similar behaviors. A behavior is defined as stereotypy when it fits the requisite form, which involves repetition, rigidity, and invariance, as well as the tendency to be inappropriate in nature. Stereotypy is a concern because it can interfere with skill acquisition, adversely affect the individual by interfering with more desirable behavior, and can be disruptive to those around him or her. Most studies have shown that experimental analysis of stereotypy indicate that it is either automatically reinforced by the sensory consequences that it produces, or is controlled by multiple sources of reinforcement, including the sensory consequences. Much of the research on stereotypy and automatically reinforced behaviors has focused on extinction procedures. Specifically, Ahearn and colleagues in 2007 used a response interruption redirection procedure to determine whether vocal stereotypy could be redirected, and found that by interrupting the vocal stereotypy and redirecting the behavior towards more appropriate responses that the individual had learned during instruction, produced substantially lower levels of vocal stereotypy than at baseline.
Response interruption redirection has also been described as a punishment procedure, since previous research has suggested that response interruption redirection's behavioral mechanism consists of punishment. In addition, research has also shown that presenting demands contingent on vocal stereotypy functioned as a positive punishment contingency.
Additional research on the treatment of stereotypy has often focused on increasing alternative behavior. Ideally, those that, like stereotypy, are maintained by the sensory consequences that it produces. Specifically, Hanley, Iwata, Lindberg, and Thompson conducted a study in 2000 that involved using the stereotypical behavior itself to function as the reinforcer to increase alternative behavior. John T. Rapp in 2006 evaluated the methods and effects of identifying match stimulation for automatically reinforced behavior and found that non-contingent match stimulation did in fact provide stimulation that functioned as a substitute for the automatically reinforced behavior. So let's talk a little bit about how these interventions are done. Response interruption redirection is quite simple to implement. When the targeted behavior occurs, the teacher or therapist will interrupt the behavior by physically and/or verbally blocking the learner's attempt to engage in the behavior. The exact type and level of prompting should vary from learner to learner and should be defined in the learner's behavior intervention plan. After interrupting the behavior, the therapist will then redirect the learner by prompting him or her to engage in a more appropriate alternative behavior. The National Professional Development Center on Autism Spectrum Disorders offers the following descriptions of some stereotypic behavior, along with possible alternative behaviors to teach. Reinforcement should be provided to the learner for engaging in the alternative response. As always, a preference assessment should be administered, and reinforcers should be selected that are highly motivating and effective in increasing the alternative behavior. As the learner begins to use the alternative behavior independently, the reinforcement should be thinned to allow for maintenance and generalization. And remember, as mentioned earlier, research has also shown that using the stereotypic behavior itself to function as the reinforcer can also be successful in increasing alternative behavior. Match stimulation procedures involve identifying items or activities that match the stimulation that is provided when the individual is engaging in the stereotypic behavior. For example, a rocking chair could be used to substitute or replace rocking behavior. A chew toy could be used to replace mouthing of toys. Drums could replace tapping behavior, and so on and so forth. You can get creative here. It's not always possible to know for sure what specific sensory stimulation the learner is receiving from engaging in the behavior, but observe and try different things. I had a learner once who loved to knock things over. A toy bowling set and a set of dominoes were effective in replacing this behavior. Another learner I worked with would smell things, inappropriate things, at inappropriate times. Giving him a bag full of things that had various strong scents was effective in decreasing the instances of that inappropriate behavior. Providing match stimulation can be used non-contingently or on a specific schedule of reinforcement. More data is needed, but all of these interventions have been shown to be effective in the treatment of stereotypy when the behavior is maintained by automatic reinforcement. As with any intervention, all studies emphasize the importance of identifying the function prior to choosing the intervention. I personally have had a lot of success using a treatment package consisting of both match stimulation procedures and response interruption redirection to treat stereotypy that is maintained by automatic reinforcement. Response interruption and redirection can be tiring to both the learner and the therapist, especially when stereotypy occurs at high rates. Therefore, combining that with match stimulation procedures may decrease the MO to engage in the stereotypy, resulting in fewer implementations of the response interruption redirection trials and lesser stereotypy. Please comment if you have used any of these evidence-based strategies with your learners and what the results were. And please subscribe to our channel if you'd like to learn more about behavior analysis and help spread the science.